Welcome back to Anything German Shepherd. Sometimes caring for a German Shepherd can mean facing some tough medical realities since GSDs are prone to certain genetic health conditions. Hip dysplasia is one of the most worrisome of these health issues for German Shepherds because it can cause your dog a lot of pain and it can cost you a lot of money. The simplest explanation for hip dysplasia is that the ball and socket of the hip don't form and work properly. When the socket doesn't form properly into a cup or circle shape, the ball of the femur can't fit into it the way it should and can cause all kinds of problems. There's only one surefire way to prevent German Shepherd hip dysplasia, and that is careful breeding, since reputable breeders that participate in the OFA and CHIC database post results of their breeding tests. This not only verifies their parent dogs are free from genetic hip dysplasia, but ensures healthier puppies in future generations. You should always ask your breeder to show you proof that these tests have been done. There are also some ways to potentially minimize how severe a dog's hip dysplasia may become, including feeding it the right food, adding supplements to its diet, and keeping your dog at a healthy weight for each stage of life. Because every case of hip dysplasia is different, always talk with your veterinarian about what the right approach is for your dog. German Shepherd hip dysplasia is heritable, which means it is present in a GSD puppy's DNA right from birth. However, GSD puppies will typically not show any visible symptoms of hip dysplasia since they're so little. Unlike smaller breed dogs, the German Shepherd could take anywhere from 18 to 36 months to finish growing. And while your dog is growing, the bone plates will still be soft and the hip bone and femur will still be growing and forming. As the hip bone grows, the socket will start to form irregularly, and this is the point where you may start to notice symptoms. One of the most important things to remember about hip dysplasia in German Shepherds is that it can happen in just one hip socket or in both hip sockets. And there are several common symptoms that can indicate your German Shepherd may be developing hip dysplasia, including persistent overall lameness or stiffness while walking, difficulty getting up or sitting down, bunny hop movements that seem to favor one side or the other, lameness that seems to favor one or both hips, pain or sensitivity near the hindquarters, and avoiding climbing stairs or ramps. The first step in making a firm diagnosis is always going to be taking your dog to see your veterinarian. If you've adopted a rescue GSD, or you've purchased a puppy and the breeder didn't provide any health history or proof of testing for the parent dogs, you'll want to see your veterinarian right away. They'll be able to perform diagnostic testing for various health issues in order to best prepare you for any future risks. But the gold standard for hip dysplasia diagnosis remains X-rays of the hip area. Veterinarians can also diagnose the condition by feeling and manipulating the hip joint area, but an X-ray will still be needed to confirm the diagnosis. But despite all this, German Shepherd hip dysplasia is definitely treatable. Canine non-steroidal anti-inflammatory drugs and other health supplements can be helpful to lessen inflammation and ease pain. When the hip dysplasia doesn't yet warrant surgery but does interfere with your GSD's quality of life, your veterinarian may prescribe physical therapy along with weight management, since overweight dogs will be putting more pressure on their hip joints. Physical therapy can help your dog strengthen key muscle groups and learn how to work around the hip abnormality. But unfortunately, when medication, weight loss, and physical therapy still don't completely ease your dog's discomfort, it may be time for surgery. Thanks for joining us today. Please feel free to subscribe to our channel and newsletter, and don't forget to hit the like button. Until next time.